host of the Journey to Motherhood YouTube channel. Today we have a special guest in our channel, Dr. Stephanie Liu. In this video, she shares her medical advice and tips on trying to conceive. Dr. Liu joined us in our Facebook group community for a live Q&A, and it was so insightful. To join in on the conversation next time we have a guest in the Facebook group, join our group with the links in the description. I hope you enjoy the conversation.
Okay, how do you address blocked fallopian tubes? Okay, so fallopian tubes are kind of what I was talking about. So you have the uterus there and then the tubes that connect to the ovaries. Oh, but that's not, so you have the uterus and the tubes, and these are the fallopian tubes, and then your ovaries there. So sometimes the fallopian tubes can get completely blocked or partially blocked. If the tubes are partially blocked, sometimes, people can still get pregnant, and we don't even need to do anything. Sometimes if they're more blocked, procedures might need to be done to open up these tubes. Or sometimes these tubes are so blocked that nothing can be done other than trying to retrieve the eggs instead. So essentially there's a few ways to fix blocked fallopian tubes. So one, if they're are only partially blocked, then you don't really need to do any much. You just kind of hope. Often people can still get pregnant. If they're fully blocked, you may or may not be able to do procedures to open up the blocked tubes. But if they're completely blocked and you cannot do procedures to open it up, often people just do IVF. So they'll just retrieve the eggs instead of opening up the tubes. Okay, so I have another great question about PCOS, so polycystic ovarian syndrome. So the question is, what are some telltale signs of PCOS? So one of the first things that people with PCOS have is irregular periods. So they might say, I get my period once every 3 months, or sometimes every 6 months, sometimes every 8 months. So these really irregular periods, and often they also have symptoms of excess male hormones. So what that could be is, excessive male hair growth, acne, or sometimes even male pattern baldness. Another association with PCOS is sometimes people with PCOS are a little bit heavier set, so they may be overweight or obese. And this also puts them at a higher risk of developing diabetes or sleep apnea. Yeah, and we have an excellent follow-up question. So how can you increase your risk of getting pregnant if you have PCOS? So one of the first things you can do, and that's recommended by physicians, is weight loss. Even a small reduction in weight, if you're overweight or obese, can actually increase your risk of getting normal ovulation. So we really recommend that. The next thing, as we recommend with anyone that's trying to get pregnant, is to quit smoking, which is really hard, I know, but that really has been shown to increase someone's risk of getting pregnant. The other thing is avoiding excess caffeine consumption. So just to be clear here, you can still drink coffee, but really make sure that you're not drinking excessive amounts. So what I say is, if you're trying to get pregnant, limit it to less than 2 cups of coffee a day. Reducing alcohol consumption to no more than 4 standard drinks a week. There's also medications you can take if you have PCOS that help stimulate ovulation. One of them is called Clomid, and the other one's called letrozole. And those are 2 medications that are commonly prescribed to help people ovulate. Okay. So the next question I have is what do you do when you can't conceive and your doctor can't seem to find anything? And I hate this word wrong with you, because there's nothing wrong with you. But sometimes about 15% of couples that try, sometimes a medical cause cannot be identified to figure out why you cannot get pregnant. What we recommend in terms of lifestyle is kind of similar to what I discussed before. If you're overweight or obese, weight reduction, quitting smoking. There are some studies out there that say, if you're having a well-balanced diet that's rich in omega-3 fatty acids, so fishes, that may be beneficial. We also recommend, if you're trying to conceive, making sure that you're getting that folic acid and making sure that you're not deficient in important other vitamins like vitamin D, iron, or vitamin B12, iron, or vitamin D. Another thing is, if your doctor cannot find any cause of you not getting pregnant, sometimes, we recommend actually touching base with a fertility doctor just to see what some of the other options are. So things such as intrauterine insemination. So that's IUI, and that's when the sperm is taken from the male partner and put into the uterus of the female partner, or even IVF too. Okay, so other great question I have is, what are ways to treat low AMH levels? So AMH is an acronym that's used to describe this hormone called anti-Müllerian hormone. Um, Anti-Müllerian hormone is actually an indicator of how many eggs we have left before pregnancy. High levels mean that you have lots of eggs remaining, and low levels mean that you have few eggs remaining. Unfortunately, there's no treatment to change the levels of eggs that we have. Okay, so another very good question is, when is it a good idea to see a specialist? So we normally recommend seeing a fertility expert if you don't get pregnant after having unprotected sex for 1 year. We also recommend seeing a fertility specialist on an earlier basis if you're 35 years old or older and you've been trying to get pregnant for 6 months. If you are close to the age of 40, you can see a fertility doctor right away. We also recommend, seeing a fertility expert if you have a known history of medical conditions that could make it a little bit harder for you to get pregnant, such as endometriosis, or if you had cancer and had to be treated with chemotherapy or radiation therapy, or if your partner has been known to have difficulty with conceiving in the past. Okay, this is a great question. In addition to stress, what other factors could cause a missed period? So this is something that I see all the time in my clinical practice. Sometimes when people are stressed out, they miss their period. And fortunately, after another 2 cycles, it often comes back and things get back to normal as the stress kind of reduces. But there are other things that can cause a missed period, one of them being pregnancy. That's one of the telltale signs of pregnancy, when you stop getting your period. Thyroid abnormalities, is too slow or too fast thyroid can cause your cycles to be crazy. PCOS, what we talked about earlier. If you're really sick, so if you have untreated diabetes, kidney disease, or if you're really nutrient deficient, if you're struggling with an eating disorder, times like that when you're really sick, or if you're nutrient deficient, that could cause irregular periods. Something called a prolactinoma. So in our brain, we produce prolactin, which is a hormone that's used in breastfeeding. And when the levels are too high, it can actually stop people from getting their periods. And also issues with inside the uterus that can block the passage of menstrual blood can also cause people to think that they are not having a period. Okay, you guys, I think that is all of the questions that you guys submitted earlier, and I'm gonna see if you guys had gave me some more questions. I think there are a few more. Okay, so you guys, I have some really great questions from you guys. So first off, Perla, thank you so much for coming, and thank you for your question. Do thyroid issues affect fertility? If so, what's the best first step to take? So that's a great question. Yes, thyroid levels, if they're abnormal, can affect fertility. So what the first step is if you're struggling with getting pregnant, everything has come back as normal, I recommend getting a thyroid hormone blood test. If your level is too low, what doctors often do is give you a supplement and make sure to target it around the number 2. So that's a TSH, the thyroid stimulating hormone level of around 2 is what we typically target it at. So yes, great question. So just to reset, get your doctor to check your thyroid levels if you have concerns about that. And yes, thyroid levels should be abnormal thyroid hormone levels should be managed during the period that you're trying to conceive, and even after that. Yeah, so Tracy, thank you so much for coming today too. And you have a great question. So can I improve my chances of conceiving with endometriosis? So that's an awesome question. So first off, I just want to say people with endometriosis it may be slightly harder it might be harder to get pregnant, but I know lots of patients over my career that have had endometriosis and have successfully gotten pregnant without any issues. So some people won't even need to get a fertility assessment or see a specialist, and they'll just naturally get pregnant themselves. Sometimes with endometriosis, if you have let's say endometriosis, and endometriosis, for those of you that haven't heard about before, it's when the tissues from like inside the uterus, so tissues, endometrial tissue, gets deposited in other places where it shouldn't be. So sometimes it can even block the fallopian tubes. So in that case, what sometimes people do with people with endometriosis is they do a procedure called laparoscopy, and that's essentially putting cameras into the abdominal cavity so they can look at the uterus and look at the other female structures and make sure that the endometriosis deposits are not causing problems with fertility. But once again, I just want to reiterate that there are lots of people with endometriosis that do get pregnant successfully without any issues. Desiree, thank you for your great question. So your question is, if you have endometriosis as well as PCOS, what are the best practices to take to get pregnant? So this is, it's a challenging situation because you have, two conditions that are challenging. With PCOS, it definitely can cause some hormonal changes. And with endometriosis, sometimes people experience pain from that too. One thing this is just such a great question, Desiree. I need a second to think about this. Yeah. So, I still think that I would still recommend kind of the things that we recommend in general. If you're overweight or obese, consider some weight loss reduction. Making sure that you're taking your prenatal vitamins. So making sure that you have adequate amounts of folic acid, and that you have a supplement that has iron, vitamin D in it, vitamin B12 in it. One other thing that is recommended is, in general, an active lifestyle can sometimes help too with weight reduction. But once again, just on a positive note, I have had patients with both endometriosis and PCOS that have gotten pregnant naturally. It is still very possible. But with these two conditions, I do think it would make sense to touch base with a fertility specialist to see if they have any other subspecialty advice for this. Okay, Kaylee, you have a great question too. So my cycle has been about 34 days. Is this normal? I'm still ovulating, but the date fluctuates. So that's a great question. Without knowing your full past medical history and your full history of cycles, I can't really say whether or not this is normal for you, but what I can say is that there are many healthy patients that have regular cycles that go between, sometimes 21 days all the way up to 40 days. And what we look for as physicians is that this is kind of their kind of regular cycle. So like, for instance, for me, my cycle's around 35 days, but that's kind of my consistent thing, 35, 35, 35. So if it's a big change in pattern, that's when I would be a little bit more alarmed. But I still think it's a good idea, if this is a change from your normal, to touch base with your healthcare provider. You guys are making me feel very cool. I have a lot of questions here. Okay, so for Alma, are there any specific foods we need to consume while trying to get pregnant? So that's an awesome question. Nutrition's kind of a controversial area in medicine. Some studies say, eat a certain food, some say don't. What I do recommend in general, for even if you're not trying to get pregnant, is to eat a well-balanced diet. Omega-3s found naturally in foods such as fish have been found to be beneficial in multiple medical conditions. And so I recommend having a diet rich in omega-3s. I also recommend, having a diet full of fresh fruits and fresh vegetables. I think it's great too. and making sure that you have a supplement with folic acid in it, which is one of the most important vitamins of pregnancy, and also making sure that you're getting adequate amounts of vitamin D, iron, vitamin B12 too. So I have another question from Rebecca. I was diagnosed with diminished ovarian reserve. Can you explain exactly what that is? Yeah. So Rebecca, without speaking to your physician, it sounds perhaps similar to something like the AMH levels, the anti-Mullerian hormone levels. So what that could mean is that you still have eggs for trying to conceive, but not as much as would be ideal. Unfortunately, with that situation, there are still many people that can get pregnant, even if they do have a diminished ovarian reserve. Thank you guys, and thank you so much, Premama Wellness, for organizing this. And I think that was my clinic assistant telling me that I'm very slow today and I need to get back to clinic. But thank you guys so much again for attending. Thank you, Premama Wellness, for organizing this. And I hope to see you guys back again soon.